Thank you, Mr. Chairman. So the 340B program helps hospitals and clinics providing care to the most vulnerable patients, the uninsured, the underinsured, people with HIV or AIDS, kids with cancer, by requiring drug companies to provide medications at a discounted price. So, of course, the drug companies are fighting to limit the program. And I get it. No one likes to be forced to hand out a discount. And I understand why drug companies want to make sure that these discounts are only going to hospitals that treat people in need. But the drug companies have now started attacking the 340B program, a drug discount program, and I've started following the press reports on this. The argument is that it's contributing to the problem of high drug prices. That is, that the 340B discount program contributes to the problem of high drug prices. So I just want to look at this for just a second. Ms. Riley, your organization, called PhRMA, I think is how it's pronounced, represents drug companies, and according to HRSA, the government agency that administers the 340B program, and I think these were the same data that Senator Alexander just quoted, drug companies were required to give roughly $6 billion in 340B discounts in 2015. Is that about right?
There were $16 billion of sales in 2016.
No, I'm not asking the question about sales. I'm asking the question about you were required to give about $6 billion in discounts.
That's 2015 data. It would be $8 billion in 2016
Okay.
if you're looking at just the discounts,
We've got about
but not the sales.
Yeah, but I'm looking at, that's what I want to know. I want to know how much you had to give up for this. Because that's what creates, to me, the big problem with PhRMA's argument that the 340B program raises drug prices. If 340B didn't exist, drug companies would have an extra $6 billion in their pocket. That's less than 1% of global pharmaceutical sales revenue, which also in 2015 was $775 billion. Or, if you don't like that comparison, we could use the size of the U.S. drug market, about $457 billion in 2015. Here the discounts worked out, as Senator Alexander pointed out, to a whopping 1.3%. But no matter what denominator you use, it is clear that the total loss to these drug companies, the loss that they're kicking and screaming about right now, is a tiny fraction of the many billions of dollars that they pull down every year in profits. So, Dr. Siegel, according to an analysis by the Government Accountability Office, the average profit margin for drug companies in 2015 was 17.1%. You represent hospitals that serve a large share of uninsured patients and patients receiving coverage through Medicaid. How do the profit margins of the drug companies compare to the profit margins at your hospitals?
Thank you, Senator Warren. The drug companies' margins are about 6 times ours on average. Our average member is 3%. And let me be clear, many of our members are frankly losing money, sometimes millions of dollars per year.
All right. And Ms. Veer, if health centers lost access to these discounted drugs, do you believe that patients would be better off or worse off?
Oh, they would be far worse off. I can think back to a time when my health center, we're very geographically dispersed, our patients are, and we implemented a delivery service to get affordable medication out in those areas. I think back to before that happened, and we had a very difficult time managing the chronic disease of those patients. I would also say, as it goes to the margin issue, I operate on anywhere from a 1 to 3% margin in my health center at best, and without 340B, we would see that drop probably into the negative double digits, which would, of course, mean the resultant cut in services that we could provide.
A 1 to 3% margin compared with a 17.1% margin.
Yes.
Profit margin for the drug companies. You know, I think it's always fair to look for ways to improve a program like 340B to make sure it's supporting those who need it the most. But that's not what the drug companies are doing right now. The drug companies are pulling out a trusted Washington lobbying playbook. They shift the blame for the skyrocketing cost of prescription drugs onto someone else. Blame the pharmacy benefit managers, blame the insurers, blame the hospitals, blame anyone else. But whatever happens, make sure that no one focuses on the out-of-control drug prices that the drug companies are charging. charging simply because they can. I believe we should spend some time focusing on the high cost of prescription drugs instead of chasing around wherever the drug companies want us to go. Thank you, Mr. Chairman.